Good morning, everyone. Thank you for joining us. Today, we are super excited to have with us Dr. Kelly Fortier, who is a doctor of chiropractic, who is also a pediatric chiropractic. And boy, I can't wait for us to join in and dive into what it is that she does in her practice. And again, today is really about helping you to understand not only, kind of how a doctor of chiropractic uses thermography scans to help you with your action plan for your health and well-being, but I really wanted to take some time today to talk to Dr. Kelly and really talk about why, chiropractic is so important. What are some of the things it can be used for? And then I'm going to share towards the end a personal story as well with all of you. And so please stay tuned with us here. We are recording this and we will be sharing this out with everyone. So without further ado, Dr. Kelly, welcome to Thermography Clinic New Brunswick's webinar today. Thank you so much for joining us. And it is such a pleasure to have you here today.
Thank you. This was exciting. From the moment you invited me, I'm like, ooh, this is going to be so good. We always have so many great conversations and very aligned in our thinking. So it's just a natural fit.
Sure do. We sure do. So, Dr. Kelly, there's a ton of things that we want to talk about. So, just so everyone knows, Dr. Kelly and I were, trying to coordinate our notes because we could probably go on for quite some time, you and I. So, I was so blessed that I actually got to meet Dr. Kelly at an event that we were both speaking at. And Dr. Kelly, I remember sitting at the back of the room and I had no idea who you were. And then you started speaking and you started doing your presentation. And I was just like in awe. And I was like, I so need to talk to this girl. So Dr. Kelly does a presentation. It's called The Perfect Storm. And we will get into that. But I want you to keep that tidbit. I want you to write that down, The Perfect Storm. Dr. Kelly has another one coming up here shortly that we're going to talk about. But I loved that day, Dr. Kelly, that we got to connect and meet. And it's been a wonderful journey of friendship ever since. And you've taught me a lot. So one day we were talking about, I had sent a couple of people to see Dr. Kelly and her husband. And it was phenomenal, the results. And so we got talking about, how chiropractic care and thermography kind of really blend together. So I'm just going to pass it over to you, to Dr. Kelly, to kind of start talking about, some of the topics that you wanted to share today in people's health and wellness journey. Because again, that's what this is about today, is us sharing what can people do to truly help themselves.
Yeah. So when we met, we've been using thermography. It's a slightly different tool. Our testing is a little bit different than yours, but we use it for the same reason. And we've been using thermography as an indicator of stress in the nervous system and how it's functioning, because oftentimes we wait for a symptom or people are coming in with pain, and we'll talk about this, I'm sure, in more depth, but understanding someone's nervous system, that system that controls every single aspect of their body, including their outward temperature, their inward temperature, all of that stuff is regulated through the nervous system. So using that as an objective tool to give us better clinical indicators of what, like the depth of that stress, the health of that person, the care plan that person would need. Thermography is such a great tool for that. And we've been using that to use it as an outcome measure for people as young as a few days old to people as old as 100 years old. And that's what we love about this test, because it's non-invasive. It gives us so much information. It really gives us the health of the person, because oftentimes we're sort of led to believe that if we're not feeling ill, then we must be healthy. And that really isn't the definition of health at all. But we don't necessarily know things that we should know to help us have an idea of how our health actually is. So that's why we use it, amongst a few other neurological tests like surface EMG, again, looking at the tone of their neuromuscular system. And then we also love using heart rate variability. So I'm seeing a black screen right now, Catherine. I'm not sure if you can see me right now.
Hang on 1 second, though.
Okay.
I let somebody else in that was in the waiting room, so we're good now.
No worries. Yeah, so for us, it's been awesome. And then when I heard you speaking, I'm like, gosh, who is this Catherine person? I've heard of your clinic before, but sort of saw it more as a breast health indicator. I was not necessarily aware of the depth, and I should have been, but I thought your focus was, well, it is women's health, but I honestly it was just amazing to hear you speak because you use the same language. It's broader than I even could imagine. I learned so much from your presentation, and then working with with similar patients, like working together, it gives us so much more information. So our thermal scans look at spinal health, and we know as clinicians that those spinal nerves go out and help to connect with every single cell in your body. So when we see an area that might be related to the adrenal glands, we can communicate that. But then to actually have the full surface, of their skin and having that visual has really made such a big difference in some of those cases. So I feel the more information that we can have, the better clinical judgment we can have, which leads to better clinical care management. And then we have that outcome measure that we can retest and see the progress, right? And again, beyond symptoms, usually when people are healthier, they feel better, but now we're actually quantifying it and we can have imaging to back it up.
Yeah.
So I do love that part of it. It's awesome.
Great. And, a couple of key things that for people who are just joining or, listening to the recording, Dr. Kelly touched base on some really key critical components, right? So one, if you think, you're not in pain, so you think, oh, well, I'm really healthy because I don't have any pain. However, oftentimes, because we live in a society where we're very reactive, right? Especially with our health. So if you're sick, go to the doctor. Or if you're sick, reach out to different, practitioners. But what about taking preventative care, right? So the day that I went to see you, it was interesting. I wasn't having any issues.
Yeah.
Which I already knew 4 years ago, or I should say almost 6 years ago now when I had my own breast health scare. And, thermography, it was thermography that showed me what was happening in the body. Even though I'd had all the testing done at the hospital, nothing was coming up because the, mammograms, ultrasounds, right? And even the blood work, it's all very, that first part, mammogram ultrasound, was very structural based. Well, I didn't have anything structurally going on, right? And we all know that it takes 6 to 8 years or 6 to 10 years, depending on what study you look at, that takes a lump to develop.
Right.
And by the time the lump is
like cellular, we don't have the testing that's sensitive enough to pick up that process as it starts to begin. Yeah.
Exactly. So it's kind of that it's that early preventative piece, right? And so when I went to go see you, and when I had the thermography scan that you guys do, that's very specific to the spine, it was very interesting and eye-opening for me because I was like, you know what? Right? I had issues with constipation for years. Does that go back to my accident that I had when I was 6 years old? Absolutely it did, right? And then, when I started down on that path of doing some chiropractic care for my body, what a difference. And I didn't even know that I didn't feel okay until I started to go, oh, wait a minute, I feel 2 feet taller, or wait a minute, like I'm sitting up better, or I'm sleeping better, or my ears aren't driving me crazy as much as they were because of all the years of traveling on planes. I always had that plug in my ear. However, through chiropractic, right, it healed it. So there's lots of different things like that, but it was interesting because doing your scan on the spine really helped to connect the dots to my overall full body scan.
Right. Yeah. And it's also interesting too, because you can look at it from a perspective of the end, the end result on the surface of the skin, but knowing where spinally that could be impacted, that's really important too. So there's understanding that nervous system's in your spine and it's going up to your brain, and all that information feeds back and forth, and your kidney functions because your brain tells it to, and your kidney's sending messages up to your brain to give it feedback. And so it's just a feedback loop. And so chiropractic works on the spine, but it affects globally, right? It affects every cell of the body, not just the spine itself. So it's pretty cool when you see those two pictures together. And when you've sent me pictures of people's scans and I've matched them with ours, I'm like, oh, this is so cool, because it's showing the same picture, but in a different way and more in depth. And as I was saying this too before we started, but it's, people think of chiropractic from like a back pain or a neck pain perspective. And so even though we have a really in-depth intake form and we ask certain questions that are unrelated, so to speak, to their reason for coming in, they may not realize the connection of why we're asking that and why that matters. Even in the adult intake form, we're asking you about your birth and all of
Right.
this stuff matters, right? But when we look at your scans, oftentimes, or often enough anyway, people don't realize that, if you have constipation, for instance, they might not bring that up in the history. We might not even see that. So understanding someone's global health is so important to us. And that piece was really cool in a few of your scans that you have sent us, where I'm like, oh, I can inquire about something that they may not have brought up. And we can dig deep into that and relate it back to, their overall health and how chiropractic helps that. And it's just been really awesome.
Yeah, absolutely. And Dr. Kelly, there was I had to, it just prompted me to remember a conversation as well that I had with another doctor. And it was interesting, like you had said about, being able to correlate when you see inflammation on the stomach, for example, right? But and being able to ask them, what else is going on there. And, it was just interesting from their perspective, because a lot of times some people don't even know that they've got issues, or they won't correlate back to like an accident that they had 15, 20 years ago, and
Right.
how that impacts vagus nerve, right? I talk to a
Mhm.
lot of clients about this, and I'm like, they've got major stomach issues and tinnitus, they got all this stuff going on. And I'm like, have you ever had an accident? And they're like, well, yeah. We ever treated, like, between a chiropractic or an osteopath for, what was going on? No.
Right.
Didn't know anything about the vagus nerve, right? So it's all these types of questions. And I love that you'd said is they may not think about even putting it on their intake form because it's something that happened so long ago, but yet it's been brewing over the years, right? And coming up. And one of the doctors had said, I lost my train of thought on the other doctor, but there's this one that I was sharing with you. And he had said, Catherine, what I find is, he said, we work with people on their action plan to get them healthy
Right.
or healthier. And he said, they're kind of like, yeah, they're in it. They're doing a couple of things. But he said, then all of a sudden they go to you, they get a scan done. He said, then all of a sudden they're back in my office going, oh my gosh, like I got to take care of this and this. And it's not to make fun. Please don't anybody take that the wrong way. Or we're designed as human beings to react when we see something or feel something, right? We're not designed, or we haven't been taught to be very, proactive, right? And I'm the same way. And what he said, though, is the people that have had the scans, he said they're so much more invested in their health plan and doing the actions, because now they've got a picture that shows this is what's happening on the inside of my body. I might not be feeling it, but this is what's happening on the inside, and I need to take care of it and be more invested in my healing journey, right? So
That's where fear can be a good thing. A
right,
little bit of,
exactly.
right? Like you have the, oh gosh, because we think, even myself, sometimes we think we're invincible. Oh, that'll never happen to me. I'm almost healthy. I'll put my health on the side. I kind of do a little bit. I probably could do more. But fear is not good, but a little kick in the butt is sometimes all we need. And that can prevent someone from actually getting a scan too, or coming in, because sometimes people just don't know, like intuitively they know that something might not be good, or they, it's maybe subconscious, but if we're waiting for a big symptom, like symptoms are usually the last thing to show up, or it's already in a, pretty well in depth, this pathway going on, or this stress going on that's leading to this pathology, or this change in structure, or this change in cellular health. Yeah, we sometimes that image is just so like great kick in the butt.
Yeah, absolutely. And you hit on another topic too, and I want to pinpoint this, so cellular health, right? So
Right.
this other doctor that I follow, he's amazing. And he said, at the end of the day, he said, there's only one disease. The industries have created 350,000 plus diseases and more out there. But when you peel back the layers of the onion, there's only one disease, and that is the cellular level.
Yeah.
Is your cell asking for help, or is it healthy?
Right.
That's the only disease. You can put whatever label that you want on it from a disease perspective, but at the end of the day, it's cellular health, right? So how is your cellular health? And that's the only way that a disease shows up. And inflammation is your precursor, right? And I think to your point, when you said about people are also afraid, right, to come and have a scan done or to go see a chiro because they're like, well, what if there's really something? Well, I'm going to tell you that over the last 4 years of doing all these scans I do on people, the people that come and they find out things, and it's kind of that heal before you feel.
Right.
There's so many people, so many wonderful practitioners that are out there doing amazing things, right? That your health and well-being is very doable, and getting you back to that homeostasis state is very doable. So like people like yourself, your husband, and, Dr. Jay, right? John
Jay. Yeah. Jay's my husband. Dr.
Jay, John, yes.
Yeah.
But, you're doing some phenomenal things there, right? And so it's just to be able to help people understand that a little bit better.
Yep, absolutely. So
do you have anything else, Dr. Kelly? Because what I'm going to do is I'm going to do a little housekeeping item here for a real quick second. And
yeah, sure, do that.
I am sorry but if you have questions, please put them in the chat box, and we will take a pause here in a little bit to answer your questions. And for those of you that are watching on the recording, what we'll do is in the notes, I will put Dr. Kelly's contact information. So if you have a question for her, you can direct the questions to her. And if there's a question for thermography, you can direct them to me. All right. So we'll do that. Okay. So we talked a little bit about how, from a chiropractic standpoint, you're utilizing the thermography scans. Like I said, you already do a different version of thermography, but it's very specific to the spine. You're adding the bigger picture onto the ones that you have, which then gives a much bigger picture and additional items that you can work on to help that client. And, I got my train of thought back, Dr. Kelly, and what it was is, it was really interesting because this person had said, but the bigger picture aspect, and that is, when you have that bigger picture, your therapy plan or your action plan with that person becomes that much more impactful, because what he stated is, I can work on this, what's showing up in like your intake, let's say, I can work on this. But if there's other underlying issues that are not being addressed, what I'm doing up here may not stick long-term. I'm not saying you in particular, but for his perspective, he's like, the scans allow me to see a whole picture. And if I don't have that, oftentimes there could be something else underlying that whatever I'm doing is not sticking because there's a bigger issue. And it's all about the root cause.
Right.
I
Absolutely.
know you have some stuff you want to talk about root cause. So that's where I'm going to pass the baton back to you.
Well, my train of thought as you were saying that was that piece that I had learned about root canals, and someone having like abdominal pain, and I might be thinking, okay, like we're going to adjust the spine here, we're going to trigger the vagus nerve, we're going to do all this stuff, but then the root cause is that root canal that's causing all the inflammation that's traveling down. And if you don't know what I'm talking about, you have to just follow Catherine. She has these amazing images, and root canals can be, what I learned anyway, not the way that you would want to go there. You should look into other options, but that was like, wow, okay, these things are so helpful. And that was the biggest one that stood out to me the most, because there's so many people I know that have those. So I just never had thought of that clinically being related, right? Or like relevant to stomach pain. I would have never thought of that. So yeah, I think as clinicians, as we meet new people, and if we're open-minded, we can learn so much. And so what we do is so amazing, and we can help so many people, but we have limitations too. So having that piece of extra information like we were talking about before is so helpful. And because it's not invasive, I mean, there's no harm done. Like, we're not talking, you know, a CT scan, or some people are worried about x-rays and different things like that, you know, have some impact on our body. These don't. Like, they're really, really sensitive infrared cameras that are picking up your temperature. Like, it's very mundane.
It's
It's
your
awesome.
thermal temperature, right? It's your body, it's your check engine light, right? It's
Right.
like, just like your car, check engine light comes on, you go, oh, geez, I need to go see the garage. There's something starting to go on with my vehicle. Well, your thermal pattern for your body is exactly the same thing. It's your check engine light for your body saying, hey, I need some help.
Right. And so the medical system, or just a system that we know, would put a band-aid over the light, right? Like if we're trying to mask a symptom, and as a society, we're very focused on symptoms because like humanly, we are not worried about that until it's limiting something or taking something away from us. Yeah, like we gotta move away from symptom-based care, and we've got to look at some of these tools that we now have through amazing technology advances and things like that, that we're getting way more information really easily. It's very accessible. And it's easy, right? Like, it would be no harm to stand and get the camera passed over you, or our thermal scan. We've done it on babies, kids, adults. Like, it's very easily tolerated. Yeah.
Absolutely. And so that's a great segue. So let's just pause for a second. Okay. So there's no questions. Again, anybody that's joining us live, if you have questions, please pop them into the chat room. We're going to take a few minutes to answer those as well. But that was a great segue, Dr. Kelly. There's a ton of things I could talk to you about, but I don't want to keep people on for long periods of time, because we also know that our brains can only handle so much information. But really great segue into something that I am very passionate about that you do. And I attended a session with Dr. Kelly, and it's called The Perfect Storm. Now, we talked about this in the very beginning as we joined. So I want people to write that down, The Perfect Storm. I want you to go out to Dr. Kelly's website, which is Uptown Chiropractic. She is located in Fredericton, New Brunswick. And she doesn't just serve people in Fredericton. There's a ton of people that go to Fredericton to get help from them as well, too, including myself and some of my family members. However, Perfect Storm, please, if you're in and around the local area, it is worth every second for you to drive to Fredericton and attend one of these seminars that she puts on. It is so informative. There are so many things happening with people in general, but also our children. Okay. And I'm not going to go into all the details about the perfect storm that she talks about, because I'll pass it over to her and she can share what she wants. But please stay tuned, because she's having it, I believe, October 21st again, Dr. Kelly?
Yeah. Saturday morning at 10. We usually run about an hour or an hour and a half, depending on conversations and where people want to go with it. But yeah.
All right. So when I went, it really opened my mind. And I have I have two grandchildren, and Oliver he's 5. And for all those grandmas out there, I know that they're gonna, and moms, because I'm going to tell you, I wish that I had have known when I had my 2 kids what Dr. Kelly shared with me.
Mm-hmm.
Because in that Perfect Storm seminar, my son had constant ear infections, constant issues with, sinus stuff in his nose and his eyes. And, he's 28 years old. He still is having issues with that. He's now finally going to see a chiropractor, right? Based on all the information. But what was really interesting is that Oliver had also started with the same issues, right? Constipation issues. His ears, we had no idea that he was always yelling when he spoke. He was very, very loud.
Right.
And they took him in, got his ears tested, and, the right ear wasn't functioning, properly, what have you. He also had what, people would consider behavior type issues, night terrors. They were just horrible. And, we did a scan on him, and, we're getting ready to do a second one on him, because he's been seeing your clinic.
Yay.
And the results are amazing.
Right. That's awesome.
Amazing. The night terrors are not there. They've gone.
Yeah.
They're still working with this, but this is much better as well.
Yeah.
Behavior issues, no. And it's not that he had behavior issues. It was just that he's a boy and he's, very hyper and stuff. But there was a few things that some would say, oh, maybe he's got ADHD or ADD. Okay. And quite interestingly enough, it's dissipating because of some of the issues that happened to him during birth.
Development. Yeah.
Okay, so
Yeah.
I'm going to stop there. But
Just
for those of
mention
you watching, I'm speaking from my own personal experience, and I love my grandbabies as much as I love my children, and I would do anything for them.
Yeah.
And I get emotional talking about it, but I am so thankful for people like Dr. Kelly and her team and all the chiropractors that are out there, osteopaths, the practitioners that are just doing some amazing things for people, but we just have to be open enough to search them out to do something different. So Dr. Kelly, I'll stop for just a minute and I'm going to pass back over to you.
Awesome. So yeah, this stuff gets me fired up too. I was my story, I was a child with all the ear infections, definitely a whiny child, like naggy, whatever. My parents said that I was always fussing and, upset. And so what we're missing is why, right? The root cause, is that hereditary, because your son had this? Does it naturally mean that, oh, now he has ear infections? I hear that a lot. Oh, it's hereditary. I, did this. And or the doctors are saying, and I don't mean to harp on doctors or anything, it's just maybe they're not educated, but what we deem as common, we're now accepting as normal. And that is not okay, in my opinion. Ear infections are not normal, but they are very common. So again, we want to understand why. And so I said earlier in our intake forms, it's very in depth. And even as an adult, we're asking you about your birth. And so people are like, what? I don't remember. Or if they do remember, it's because their parents let them know they were colicky, they were this, that, like, oh, if we had another child, or if you were our first, we would have had no more, all this stuff, right? And so just being in practice for just over 15 years now, when you listen to parents and you ask them and you go back, you hear a similar story. And this isn't something that your doctor is going to ask you. It's not a line of question, because the medical system is very broken up. You have, your OBs that would see you through pregnancy. Then you have your pediatricians or your family doctors, and then you might see an ENT, and it's very broken up. No one's able
Talking to each other.
Yeah, right. And you don't have time in a medical office to go back to your birth when you're 40 years old. Like, they're not going to do that. That's not realistic. So we do have that time, and we know it's relevant. And going back, and really the piece that's missing is that stress, that internal stress that we would have maybe as moms before we're pregnant. There's a lot more trouble conceiving. And so we have this emotional stress that burdens us, and that, it's hard for so many women to get pregnant. And that's one piece of the puzzle. Could be the first stress that your unborn or unconceived child could have, because our eggs, our sperm, those things are in our body, and we are those, right? So our stress is already in that, it's impacting that. So then if we are pregnant, there is, again, birth world. We could get into this so much. This is a big topic I would get really passionate about, but pregnancy in general is lined with fear, right? So we're analyzed, we're tested, we're, what if this happens, that happens? The hospital's a scary place. Like, it's full of fear. And I don't mean that, again, to harp on it, but when you have had a home birth experience, or you've worked with a midwife, or you've worked with a birth care provider, it's completely different, the care that you're given. And so it's shifting that perspective. But we're not resting, we're not exercising. There's so much stress before and during pregnancy that our babies are experiencing inside us. So our nervous system's growing their nervous system. And so if we're in that really critical time where they're laying down the foundation of their nervous system, and it is in a chemical storm of stress soup, that is going to be what they're wired for. So now we have birth, which can be very traumatic too, right? Like we have long labors, we have Pitocin, we have forceps, C-sections. And again, none of this stuff is wrong. I'm not saying, we shouldn't do that. I do think it's overutilized or used too soon. Again, a conversation that we could talk about forever. But those things matter. And when a baby's born, they'll look at the APGAR score, they look at their breathing, their color, and as long as their APGAR scores are good, we're good to go. They're not thinking about what could have happened during the birth process that might have stressed their nervous system out or injured their neck. That pulling, tugging, twisting. And then what happens? Our babies get what? They fall into colic, right? So many babies would have that, or a witching hour, or just unsettled. That again is not normal. Our babies should be able to rest and sleep. That's what they should be doing for the most of the time when they're newborns. But we don't, we hear that where babies are strong, they're arching. We think they're very strong, and that's a lot of neural tension. That's a sign of stress. But yeah, that colic just weighed it out. There's not a whole lot we can do. You were colicky, so maybe your baby is, so maybe it's hereditary, stuff like that. And then we get into the ear infections and all this stuff. Again, when we have that stress, especially birth stress, that has created a physical trauma and potentially injured their nervous system right at the base of their neck, that nervous system is going to be wired for stress. So that's where some of our most difficult cases with sensory processing or neurodivergence or autism, like some of our big challenging cases, they've had the worst amount of stress so early in life and repetitive, and that's where their nervous systems have developed. And so when we look at some of these childhood conditions, we're treating the symptom, which again isn't wrong. It's not wrong to do therapies. It's not wrong to sometimes use antibiotics when you need them. But if we're repeating this over and over and over, and what we know about antibiotics is that it affects the gut, right? And so that gut produces a serotonin that we need to help regulate our emotions. So you can see this cascade, and that's why we call it the perfect storm, because you may not have all of those pieces, but you may have a few key ones that have just never been thought of. You've never thought of it as a mom. But when you look back at those things, we just had a case where their baby fell off of a high chair and smoked their head and had a big major trauma, and now is dealing with all of these sensory issues and behavioral issues. They've never thought of that. They never thought of the physical trauma that baby would have had in that moment. Because again, the thing that we're worried about as parents is the concussion. Are they going to be okay? Like, what immediately do we have to do? Is there a brain bleed? Like, that is important. You need to make sure that's not happening, right? But after, they're like, no, it's fine. But is it, right? So when you're like, we're pediatric chiropractors, we're really highly trained in this stuff. And not all chiropractors want to see babies or have been extensively trained in that. But if they're not asking those questions, then you've just missed the piece. And it's not shame on you, mom. It's, wow, you just didn't know, right?
Just didn't know, right? It's not part of something that we're trained.
Right.
We're not trained into looking at our health from a preventative perspective. Our society is very reactive when it comes to health and healing. And again, I just want to make sure that everyone understands here, this has got nothing against our medical doctors, because I've got friends that are medical doctors and I love them dearly. But here's the thing. And I've said this before, and I know Dr. Kelly, you were in the audience when I stated this. There was a couple doctors in the audience as well that, absolutely agreed. It's about educating people. Our doctors are trained in disease management and emergency health care. Right. The onus is on us to take care of our health. And your doctor, like anybody, only has so much leeway of what they're trained in and what they can do. But your health is your responsibility. Now, if you don't know that something exists, right, that's why we do these types of webinars, right, to try to educate people that there's other options to consider. You know, the great World Wide Web, there's lots of information on it. That's great. And there's a lot that's not, but you know, you've got to be able to
Discernment.
you got to be able to sift through that. Right. But again, you know, just going back to what you say, and I'm going to just caveat this for people too. There's so much that Dr. Kelly shares in her seminar, The Perfect Storm, October 21st, 10 a.m., Fredericton. Hey, it's the fall. Fredericton has a great farmers market for those of you who want to go for the morning or a day trip. Go up and attend Dr. Kelly's seminar because there's so much information that she shares. She has just touched on the tip of the iceberg. But I do want to say that if you have children and you've got stuff going on and you're stressed because you don't know the answers or you don't know what else to do or where else to go, it's not going to hurt you to go and have a session with Dr. Kelly and her team. It just isn't, right? There's a lot of coverages that cover chiropractic as well too. So, you know, please reach out to them.
And just to put it out there, because people don't, maybe you've never thought of chiro for your baby, especially, or your kids, how we care for a child's spine and nervous system, how we work to unwind that tension, how we identify it is so different for an infant versus a child versus an adult. So it's very safe. Kids love it. Sometimes people, especially kids with behavioral challenges, or they can't sit, or they're aggressive, or they don't like people touching them. Like, there's so many things. We have never, as long as the parents can bring them, we've never had a child we can't eventually help. And sometimes, you know, it's not up on the table, but it's just like chatting with them, or it's out in the waiting room. I had just had a little girl that just learned to walk, and there was no way I was getting her on the table. She was like, no, I just learned how to do this cool skill and you're putting me on my back? No, thank you. So we adjusted her in the hallway and like made it fun. So, you know, one of our core values, it's right on our wall, is fun. And especially if you're working with kids, that are really struggling, you have to make it fun. You have to connect with them. And so that's something we really pride ourselves on. And it's just so awesome to work with them. And it's so awesome to use thermography as a tool, because they think it's cool too, to see what's going on. And kids naturally ask a lot of questions, and it's the best. I love working with adults, but I love working with kids.
Kids are fun. And, you know, two things. One, your clinic is, I'm an adult and I walked into your clinic and I giggled and I was like, man, I wish I had had a place like this when I was little, but it is fun. Right. And it was nice that day I was there. There was a couple kids in, and just seeing them light up when they came in because they were happy to be there. Right. Because your clinic is geared for kids. And, you know, and you're right. Kids are interested in this stuff, because my grandson, he came into my clinic, and God love him, he stood as still as anything when we were doing his upper body scan. Now he's 5. You know, I don't know that we would scan any other, you know, maybe when they're 4, but man, when you're getting past that, it's really difficult because they've got to hold certain positions. Right. But Oliver was just so fascinated, right, by being able to see his body show up on the screen in different aspects. And then when we got his reports, well, he thought that was just the coolest thing ever.
Right.
And, you know, now it's just like, okay, Nanny, you know, show me where the butt bone is, or show me where this bone is, or that bone. And they're just very inquisitive, because kids naturally are, right? So it's a lot of fun.
I love it.
Yeah. Okay. Now we're going to pause for just a second for questions, and then we're going to wrap up here. So if there's any more questions, please let us know. So Catherine, if thermography was free for all humans, how frequently should each person be scanned to keep an eye on things? Okay. So, you know, how often should somebody do it? I mean, there's different schools of thought on that. I mean, one, I'm very, very passionate, obviously, to helping all people, but very passionate with women's breast health and thyroid health, because those two things, and dental, right? The dental, thyroid, breast, those are my main things that I'm really passionate about. But as far as doing full body scans, of course, we do that too. And I'm really passionate about helping people to find answers to things and to, you know, help with the root cause. And, you know, again, thermography can only do so much. It's not the be all end all. It can only do so much. But to answer your specific question, Randy, how often should someone do that? I mean, I'm not going to tell you how often, but I'm going to share with you a couple of different ways that my clients use it. Okay. So I've got a 91-year-old client. She started to come see me when she was 89. She's just phenomenal. I love it when she comes to see me. She had shared her story that, back when she was 59, she was taking a handful of pills. She was sick. She was laying on the couch, just literally waiting to die. And then finally, she said, one day I figured out that God wasn't coming to get me. So I needed to do something about it. And these are her words. And she said, I decided that day that I needed to make some changes. So she did. And again, change, sometimes people get frustrated because change can be slow, but remember, it didn't take you overnight to get where you are either, right? So the body, as you continue doing all the right things, your body will shift and change. And she did. And so she's 91 right now. And I believe it was last year. Yes, last year, she went rock climbing. She was 90 then. Okay. Yes. Rock climbing. She's gone to do, at Cape and Rage, they have, it's not rock climbing, but it's, oh my gosh, it's challenging. I did it for my 40th birthday. Okay. So you're rappelling down the side of the rock wall. And she did that, okay, the year before. She walks 10K a day, every single day. She said the only days that she doesn't is when it's like freezing rain or it's slippery outside. But then she'll get on her elliptical or her bike, her spin bike. So, there's all these things. But remember, she was very sick at a certain point. So how many times does she do a scan? She does it yearly. Because for her, it's really important for her to continue living but with vitality. So that's very important for her. I have some clients who are using thermography as a basis of they're going through treatment because they're either suffering from cancer or some other disease, and they want to make sure that the treatment they're getting is working. So some of those people will do it every 6 months to make sure. Some are doing it 4 months because, again, they want a baseline. Am I progressively getting better? I do have some people that are very healthy anyways, just like that other lady I was telling you about, and they do it yearly. Some will do a half body, some will do full body. Now, if you're nervous about your health, women's breast health, again, that absolutely should be done yearly. Again, if we do your scan and we see something going on with maybe ductal pathology, thyroid, that's also impacting your breast because those two do impact breast health. Some people will come back because the doctor will ask them to come back in 9 months after we've had their baseline. So again, 6 to 9 months, but in a perfect world, right? I mean, if you could afford it and, you've got coverage for it, I mean, there's no harm in doing it yearly. If you want to do full body, just to kind of check, or, you just do mix and matches of pieces. Again, it's very individualized. So I don't want to say, here's how often someone should have it done because it's a personal choice, right? So thank you for that question, Randy. All right, so let me just see if there's any other questions. No other questions at this time. So, Dr. Kelly, anything that you want to talk about before we wrap this up that you want to share with people?
One thing I wrote down from yours is going to be backwards, but it says it's never too late. We see kids and like neurologically and developmentally, that is the prime time. Like they are basically going to have all of their foundational views of the world by the time they're 7. Their brain development's 80%, in size anyway, by the time they're 2. Like it's so important to consider that when you have an infant, but your brain is also neuroplastic. And I speak of the brain because that is, part of thermography. That is how the brain's operating its own body. Your body's not making a mistake. It's trying to heal and adapt to its environment. And so the more resilient we are, the better adaptable we are, the better health we have. And just like that 89-year-old, we think, oh gosh, we age and we get sick. And that's just normal. Again, check yourself. Normal is not always normal. It just means it's common. And so is it too late? No, it's not too late. Your brain is so capable of making changes, but you have to be committed and you have to show up and you have to want it. And so, when we work on health, we want to just reach healthy and then abandon all practices, because it's hard being healthy and having those habits and taking care of yourself. It's not easy. It's easier to let it go, but it's easy hard. And
Right.
I would rather it hard, easy. I want to be that 91-year-old, 102-year-old that's climbing.
Absolutely.
So again, like if we're focused on the peds piece, because I want to instill those in the kids that do come in. I want them to value their health, and I want them to value their bodies and know how to talk to their bodies and not wait, right? Like self-care as a child. Like my kids know to take care of themselves, and they understand that from a young age. Like what an advantage. So, people ask all the time, do you see adults? Yes, I do, but I do have this big heart for kids, because I know that's like our best leverage point. If we want to change the world, we got to start with the kids, but that doesn't negate the 91-year-olds. Like that's amazing.
It is. And Dr. Kelly, I'll leave you with this thought, right? And I always tell people, if we are blessed to age, right?
Yeah.
If we are able to wake up every day, right? And we're still here on this earth, we have two paths. We have two paths that our health is going to take. One path is disease management, which is hard, very, very hard. It's filled with fear. It's filled with anxiety. It's filled with tons of doctor's appointments and cost. You're sick. You're not enjoying your life. Okay. At all. That's one road. The other road is prevention. And on that road of prevention, there's two very different energies points here, right? Prevention, yeah, it's work, but you're learning, you're getting to meet some incredible, fascinating people, like such as yourself. You're expanding, right? And you're living with vitality. You're that 91-year-old woman that is, rock climbing. Right? You're that 91-year-old woman that is getting out every day, enjoying her walks, her 10K walks, listening to the birds. Her heart is happy. She's joyous. She's not in any aches or pains or anything like that. So you're really, truly living your life. So again, two different paths. If we're blessed to age, we've got two paths. And please, I want to share this with people. Please know that just because you age doesn't mean that you have to deal with pain and suffering, because I hear that a lot. People will say, well, I was told to suck it up because I'm 60 now.
Right.
That, I'm telling you, my friends, I am not a doctor, but I can absolutely tell you that is not the truth.
Yeah. And then find people, like you said, surround people that are on the same mission. Find your healthcare team. Know that you have the sick care team. If you need them, that's what they're good at. But find your healthcare team and hang out with those people and like get led by those people and become a partner. Like if you don't have a chiropractor as part of your healthcare team, you're missing out. Like you're missing a big piece. If you're not getting thermography, then you're probably missing a piece of a clinical indicator that will give you so much information about how you're doing and what you need to work on. So it's right there. Just go get it.
Dr. Kelly, I would be remiss if I didn't state this, because I do a lot of education too when people come. And I have to tell you, there's one misnomer that I hear all the time. Okay. And you can correct me if I'm wrong, please.
You're probably not wrong.
Well, I may be, and that's okay. Please correct me, because I always love learning. But I always hear people say, oh, Catherine, I don't want to go to chiropractor. They're going to crack my bones.
Right.
No, they're not cracking your bones. That's like scar tissue in between vertebrae that's being broken down. But they don't crack your bones, because if they were cracking your bones, you'd be in emergency, because you'd be in a
lot of pain.
So can we put that one to bed? Because people have this thought that when you go to a chiropractor, you're cracking their bones.
Yeah. And so often, like with most styles of chiropractic, you do hear a noise. And so calling it a crack is what people commonly say, but it's a release. It's a release of pressure. And so just like, if you had a bubble wrap and you kind of pulled both ends, it would release the pressure. That's a kind of not a great example, because you're not actually breaking tissue, but it's a pressure gas exchange. So if you have a lot of pressure built up and you release it, instantly you're going to feel a difference. Most people will feel different. Some people just aren't connected to their bodies yet, or there's just a lot of stuff going on. But that release, I kind of, as a joke, I call it a joint fart.
I love that.
Because it's a pressure release, just like a fart. It might make noise.
Yeah.
It might not, but either way, you feel better after.
Right. Exactly.
Right? The kids love that anyway.
Oh,
But it's a pressure release. Like we call them releases or adjustments. You know, and the words really kind of matter. But there are still some people that just don't like that technique. They don't want to be, and it's a very controlled motion. It's quick, and it's not really big. It looks more invasive than what it feels like. Most people will get it just like, oh, that's it. Like I thought it was gonna feel a lot different. It isn't a big motion, but it's quick. And so there are other techniques though, especially with kids, we use more pressure holds and try to unwind more intuitively. We have tools that like activator tool that helps us adjust if someone really doesn't want to be put in, or their body is so inflamed, which again is so cool to see your thermography scans and our if someone's like lit up like a Christmas tree, we're probably going to do a more gentle or more tonal technique because we understand they're already inflamed.
yeah.
And so if we even did a simple, like if you've ever had massage and you were like rode off for a week or two, like that's not normal, right? So there's inflammation going on there that you need to deal with. It doesn't mean that the treatment was wrong. It just means, oh, now we know more. We've got to alter this, right? So there are many ways that we can walk people through that challenge or that roadblock. There should always be options given. You should never feel pressured to do anything that you're not wanting to do. Your consent is of high value and it should be. And if you're in a situation where you feel like you're not being heard or that, your wishes are not being respected, then I think you just need to find someone else. So there are so many ways that we can help someone with that kind of fear. And oftentimes we'll start really gentle and they're like, oh, okay, I trust you, just do it. And so again, we're not pressuring everybody, and that might not be the way to care for every person in that moment. We might need to do something else. So yeah.
Perfect. Thank you, Dr.
That's not a problem. We'll help you work through that.
Absolutely. And, and you made a very valid point, right? If you're, not, I always tell people this, like, I'm not for everybody. Like, and
You're
that's
for
okay.
anybody, but not for everybody.
Right. Exactly. So, if you're seeing somebody, to your point, if you're not feeling heard, if you're not feeling that you're getting better, and I've seen this happen before too, where someone's going to see somebody for long periods of time, but they're still suffering and it hasn't resolved itself. I'm like, okay, you know what? Well, maybe their technique is not the technique that your body requires. So seek out somebody else. It doesn't mean that that person isn't doing a great job. It's that maybe that person's technique is just not what your body needs. It's okay to seek out other practitioners.
Yes. And in the end, it's patient-centered care, right? Like it's not ego. You try to leave your ego out the door, and I feel sometimes we can get caught up in our ego. But again, it's patient-centered. So if for instance we're not the right place for you, there's no ego there. Just that's okay, right? Like we get it.
We
Maybe
definitely
find
do.
someone for you that's going to work, because ultimately you're the centerpiece of what our focus is, like your happiness, your health, right?
That's right. That's right. All right. So, thank you, Dr. Kelly. I mean, I could go on and on, but we're at the top of the hour. So
Okay.
I want to keep this short, but for those of you again, watching and tuning in, if you're not live and you're watching the replay on this, I will put in the show notes, right, on my YouTube channel. I will put this, Dr. Kelly's contact information in there. Please feel free to reach out to her if you have any additional questions. Check out their website, Uptown Chiropractic. They're located in Fredericton, New Brunswick. And if you have any questions for me on thermography, again, the contact information will be there. Dr. Kelly, it's been an absolute pleasure. Thank you so much. And I'm looking forward to sending some folks down your way for October 21st for the perfect storm. Thank you.
Okay, thank you so much. I love speaking with you. So
thanks, my dear. You have a wonderful day.
thank you. Talk soon.
Bye-bye.
Bye.